At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions for Shoulder Pain on Wednesday, March 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live, and we've got another kind of looking through the weeds program today, and try to give you more tools, if you will, to get your health the way you want to get it done. You know, we're going to go on a stream right now of talking about your immune system. And here's the problem. You're being told that your immune system is outside of you, meaning something outside of you is going to make you better. You know, all these biological drug ads that you see on an ongoing basis, they're saying that's what you need to fix you. Well, the problem is that they've developed these immunological drugs to suppress the things that are going on. And we're going to talk about what that means, you know, your pains and your aches and so forth and so on. Well, that's not how the body works, and that's what I really want to get to you today. I want you to understand that we might be missing things. I'm going to give you a couple clues as well of what you can do to upregulate that immunological response in your body, and also a little bit of an idea of what you might be doing that can cause it to be problematic. I had a patient come in the other day, and they said, hey, why don't we check, what's going on with my body? I said, okay, well, I thought we were doing that on a, fairly irregular basis. This person comes in to see me probably, 4 or 5 times a year and gets checked up structurally, and we look at their biochemistry, and we look at, their dietary patterns and so forth, and there's always a little tweaking that needs to be done. But what I learned about patients over the years, after over 4 decades, is that we don't always want to fess up to the truth. And then what happens is that we wonder why we got sick, or why we hurt so bad, or why, our blood sugars are through the roof. What do you mean I have diabetes, doctor? And they don't have any perception of how they got there. Well, the fact is that they actually do. Lingering in the back of their head, there's a reason. There's something that has taken place. They know very well that they haven't been as good. But as human beings, we don't like to deal with the truth sometimes. And so let's talk about the truth as we know it to be. Let's talk about what happens when we ignore the obvious. And sometimes when we ignore the obvious, it becomes too late. So I want to give you that heads up first. Today you follow me into the live stream program, and we're going to talk a little bit more specifically about your immunological system and the things that make it go bump in the night. But I want you to understand that if you're hearing me, if you're listening to this voice, that's reversible, that you can fix virtually anything. The body's a beautiful machine. It's one that it can go backwards, it can go forward, it can never stay stagnant, because the definition of staying the same is actually you're going downhill, you're going backwards. So it's all about making a decision if you want something better than where you're at right now. So once we're done here on WMAL 105.9, follow me on the live stream. All you have to do to get there is go to drtomroselle.com, drtomroselle.com, and there'll be a little bit of a placard there. You hit it, and it'll take you right in, and we'll just continue the conversation. The other way that you find me is that you follow me on all the social media sites, from Facebook to Instagram and X and you name it, I'm there. So even Rumble, right? We're all around. And then when we're on and doing a program, you'll be notified immediately. And as I said last time we were together, that we're getting ready to actually expand the platform a little bit and have the opportunity to bring you more and more information that you really need to know about, but also to take action on. So let's kind of dig into the weeds a little bit. How many of you have gone to your doctors and you've got these ankles that are swollen, you've got, this repetitive cold patterns, you don't feel good, your energy's down around your toenails. What does it have to do with? Is it because, time is passing you by? Is it because that you neglected something, over a period of years because it was inconvenient, it wasn't timely, it took too much effort? What was your reason that you ignored you? When I was a kid, and I've said to you many times, that, back when the dinosaurs ruled the earth, there were things that we did ongoing that seemed to give us a little different edge on the subject. And what was that? Well, we actually got outside and did something. We were out walking, or we were out running, or we were out playing in the park. We had a little baseball pickup game. And, we did those kind of things. And the foods that we ate were not as adulterated as they are today. Or we don't catch as catch can. Yeah, we ate, in some cases, peanut butter and jelly sandwiches. But guess what? It was a better quality. Even bad stuff for you was not as horrific and bad as it is today. So what you need to be doing right now as you're listening to me is do a checklist of things. So let's take one piece of the puzzle. Let's say that all of a sudden you notice that your gut, your intestinal tract, is not working as adequately as it should, meaning that maybe you're constipated, maybe you have diarrhea, maybe you have cramping, maybe you're bloated after you eat, all of those things. And now you've got pain. The pain is referring up into your shoulder, going to the middle of your shoulder blades in the back. And you get a headache after, you eat something. You get a headache if you don't eat something. So all of those things have to do often with digestive function. And you sit there and you say, oh, well, and you go take, back in the day, it was Alka-Seltzer. So remember that, drop, plop, plop, fizz, fizz, what a relief it is. That's the old Alka-Seltzer commercial. That's how good they were at it. You remember it even to this day, right? But they gave you those things to modify, mitigate, diminish the symptom process, which was not a good thing. But today, even more, you're going to go in and you're going to get some sort of medication, drug that's going to suppress your immunological responses. And that's what they're doing. Listen to what I just said. Suppressing your immunological response. So, you have GERD. Well, gastroesophageal disease, right? It used to be called heartburn, but now we're sophisticated, so we call it GERD. And so GERD is nothing more than irritation of the food tube, the esophagus, because of supposedly backflushing of the contents of your stomach. But the question becomes, and is never answered correctly, is why? And then your doctor will tell you that this erosion of the esophagus, your food tube, over a period of time can predispose itself to something like Barrett's esophagitis, which is a precancerous condition. But is it something that is true? Is it something that you have to deal with? Is it because your body's failing you? No, the truth of it is that you are failing your body. You're eating things that are going to cause the stomach to be problematic, in that you are not increasing the acid levels of your stomach. You're actually lowering the acid levels of your stomach. So you have this valve, it's just like a valve, between your stomach and your food tube. And that valve stays nice and tight, nice and closed for several reasons. One of the reasons is that your stomach is very acidic. And if your stomach stays acid enough, that valve stays tight and closed, and it only opens to allow food in so you can digest it, and then you digest it and it does its thing. But when you give a protein pump inhibitor is what they're called, and it drops down the acid in your stomach, that valve will stay more open than it will stay closed. You say, how's that possible? Well, that's the way the body is designed to protect you. So now you're going to get bloating, you're going to get other types of symptoms, but you just don't feel that irritation because you're suppressing all the acid in your system. Now, here's the problem. Many problems, but one in addition to that. You have a lining in the inside of your stomach that protects that acid from burning through that muscle called your stomach. And when you don't have the need for the protection, your body doesn't repair, restore, remake that lining. And so now, if you add anything that is acidic to your system, your body is going to have a response called pain far greater than what it was before. So when a patient comes in and we know that they've been on an acid suppressor, if you will, then what we do is we have to go gently, slowly. We have to repair the system. But what's the other reason that can happen? Why am I stuck on the gut? Because so many doctors out there are giving biologicals to repair the intestinal system when it's a matter of understanding the neurology and the true chemistry of what takes place. You have nerves that go down there as well. The stomach sits underneath that big muscle called the diaphragm. If the diaphragm is not moving and opening and expanding and the way it's supposed to, you're going to put undue pressure on this stomach, and it's going to squeeze the contents and backflush it. In that case, we've got a mechanical problem. And those mechanical problems are much easier to take place if structural systems are misaligned. They're out of position. The signaling mechanism from your brain to your spinal cord to the stomach is not working. One of the signs of that is that you can have pain between your shoulder blades. That just kind of is there all the time. You don't think too much about it. You take muscle relaxer, or you take, Advil or Tylenol or one of the other NSAIDs to kind of blunt the discomfort. But when you do that, it's causing a vicious cycle to continue the process and problem. So what does that have to do, you might ask, with your immune system? Well, you need acid in the stomach and a slightly acidic pattern in your intestinal tract to kill bacteria, to kill viruses, to kill fungus and mold and yeast that works its way through your system. If that is not there, you become more predisposed to your environmental attackers. And we'll put in that. So we've been worried over the last few years of all these viral patterns that are out there. But if your body is working the way it's supposed to work, you have a front line of defenders, these little picadors, if you will, that they go in and they weaken the system up, and your body then can kick in other patterns to be able to restore, defend, and protect you. So if the acid is normal and it's not being suppressed by these protein pump inhibitors, then your body has the opportunity to stay healthier. And you also have something called IgA mucus secretion antibodies. And that's from your mouth to your tail. And it's supposed to produce another defense mechanism that's stimulated by a couple of different areas. One is your fight-flight system, your adrenal system. And if that system is not working properly, it's overwrought, then you have a problem. So what we want to do is we want to make sure that you understand that fixing these things is not necessarily about, if you will, putting a drug on it. It's a matter of understanding what is actually taking place and how your body works, and not to treat the symptom process, which we have too much of a knee-jerk tendency to do. Yesterday I was in Chicago. Actually, 2 days ago I was in Chicago. What's this? Today's Sunday? 3 days ago I was in Chicago. It was Thursday. And I went to my alma mater, National University of Health Sciences, out in Lombard, Illinois. And it's a school that offers 3-degree doctoral programs. One's in chiropractic, one's in naturopathic medicine, the other one is in acupuncture. So I was talking about 50 students, 45, 50 students, something like that. And I had the opportunity of shaking them up a little bit. And when I say that, I'm talking about getting their headspace in a place where they can take the academic education consideration that they've gone through for 5 academic years and be able to apply it properly. And I went to a higher level of kind of the same type of conversation I'm having with you. But I reversed it. I said, if you have a patient that walks in and they present like this, what are your considerations? What do you do? I taught them about something called the yet disease. And what does that mean? Well, somebody comes in and they tell me they have a stomach ache. I ask them, have you had any diarrhea yet? Have you had any intestinal cramping yet? Have you had any back pain yet? What I'm doing is I'm tracing the nerves from their structural system, from the brain, spinal cord, out to these organ systems, and knowing how they go in different directions and contact different organs, and trying to find out if, where it's really coming from. Is it a localized situation? Is it neurological and neurogenic in its origin? But then we asked questions, and I told them to do these things. Where did you grow up? To the patient. Where have you lived the majority of your life? And I used a reference that I was very familiar with because I grew up in that area in western New York State. And I said, if somebody tells you they were from Buffalo, New York, and they're a little older, they're my age or probably maybe 20 years, 25 years younger, I said, take that into consideration if they tell you on any level that they're not feeling good and their body seems to be showing X, Y, and Z symptoms. And I said, do you know why that is? And they looked at me and they really weren't certain. So I want to share this with you because it's important, whether you're Buffalo, New York, you're Pittsburgh, Pennsylvania, you're Orange County, New Jersey, you're in some of the highly toxic areas of the country. If you're from Buffalo, New York, back in the day, there was Bethlehem Steel, and they produced steel, and they used coal-burning fireplaces to produce that steel. When you burn coal, the side event of that is a highly toxic element called mercuric oxide. And it gets into the waterways, it gets into the air, and you're absorbing this in your body, and it starts breaking your system down. Many of you remember the Love Canal in Buffalo area. Also, a lot of people don't know that there are over 13 toxic waste sites that were buried in the artesian water system in the western New York area. So they have more cancers of many different kinds in that area than any place else in the country. That's why they built Roswell Park Memorial Research Cancer Institute there. So when you start asking the right question, you begin to see other exposures that you may have to deal with. And once you understand that they actually exist, then you can begin to look at why that immune system is not working the way it's supposed to. Had a patient that had, we're talking about the stomach, having all kinds of stomach problems. And the doctor was giving them, start out with low levels, things like Tums, and then they went to GERD medication. And then when that didn't happen, they started doing other stool cultures and things like that, but they weren't running the things that they needed to run. Finally, they did a biopsy. Well, at that point, it was too late. The patient had stomach cancer, but it was one that was giving off signals way in advance. So if you know what the signals really mean and you understand that there are things that will trigger the breakdown of tissue pathologically, like the things that you put in your mouth, the medications that you're taking, the side events that you have. I mean, you all listen to the television at night or the radio programs and they say, take this drug, go talk to your physician. But in the event of, are you pregnant? Do you have this going on? Do you have this going on? Are you allergic to the substance? How the heck do you know if you're allergic to the substance at all? Did you take it before? Did your doctor tell you that you're allergic for it? But don't take it, right, if you know you're allergic to it. Well, you don't know you're allergic to it. That's kind of a disclaimer of some sort. But also, more importantly, here are the side effects. Increasing the problem that you're taking it for. Making your stomach worse, your intestinal tract worse, may give you diarrhea, may give you constipation. Oh, and by the way, it might give you cancer. I don't know about you, but my body kind of recoils from that type of, be careful, don't do this type of situation. Maybe I better find a different way. See, your body was designed to do virtually anything in a repair process that it was needed to be done. That's the beauty of who we are as human beings. Except we think that we need outside intervention to correct that immunological problem, that immune system that's not working. We're seeing tons of immunological problems as time goes on. They're getting more in our face, if you will. I'll use that term because that's really what it is. But we're ignoring it because we really don't appreciate. Could that really happen? Would they create drugs like that? Oh my God, I heard it on television. I read it on the internet, so it must be true that it's good for me. Well, there's a lot of people out there making a hell of a lot of money at your expense. And so what I want you to understand, and I've said to you repetitively, is that you are the driver in your own health. Health is a do-it-yourself program. You must do your own homework. You must take everything anybody says, including the things that I tell you, with a grain of salt and say, maybe, is this true? I'm not sure. And go look it up, but do your homework on both sides. Begin to read the side effects of the things that you're being told that you should be taking. And ask the question, why is this thing not working? Ask your physicians, your healthcare provider, that one question. Why is this not normal? Why am I getting this problem? And they'll either tell you things like a made-up story, or they're going to tell you something like, if they're honest, we're not sure, or they're going to say, well, let's watch it and see what happens and see what shows up, and we'll figure it out as we go through. But in the meantime, try this and see if it works. I don't know about you, but that makes me a little uncomfortable. And so you need to really get it and understand it so you can continue the process of making things better for yourself. I would think that's important to you. I would think that you'd want to know that. I would think that you don't want to be led down the primrose track and say, well, the doc knows what he's doing. Remember the old cliche? What do they call the guy that ended up last in his class in any kind of healthcare? Doctor. So you have to be your own doctor. You have to be the one that is willing to ask the hard questions and make sure that you're getting the right answers. Because if you don't do that, you're setting yourself up for disaster. It's critical, it's important that you understand that your body has an amazing immune system, that if it's supported properly, doing little things like taking a good vitamin C product with some bioflavonoids, a good probiotic, because 75% of your immune system is in your gut, in your intestinal tract. That's why we're starting on the gut today. And we'll talk a little bit more about it as we go into the live stream immediately after the program. So I want you to join me as we kind of dig a little deeper. This is a teaser. I want you to get in there. Go to drtomroselle.com and join me, and I promise you I'll give you a couple things you haven't thought about. We're coming up to the end of the program. I wish we were here longer. I miss actually taking questions on an ongoing basis, but here's the reason that we do this, and we continue to persist to drive this information so it's usable for you. Very simply, you deserve it, but more importantly, I love you all. You have a really great day, and let me know if I can help you. You can find me at rosellecare.com or drtomroselle.com. See you in a couple minutes.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions for Shoulder Pain on Wednesday, March 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.